If you think that SSRIs like Lexapro, Zoloft or Prozac are still the only or even the best treatment option we have for depression, then I've got some news for you. And it's good news because the field of psychiatric innovation is going through a revolution right now with new research, new medications, new medical devices and more integrative practices shaking up our industry. And Spravato is now firmly established as a breakthrough treatment for depression. And for the patient, this means more choice and better outcomes. For you as a psychiatric prescriber, it's essential to stay up to date with the latest research findings and clinical best practices related to Spravato. It's a matter of ethics, honoring your Hippocratic oath and staying compliant with your duty of care. So, if you want to stay at the forefront of mental health treatment, this video is going to be really helpful as I'm being laser focused on everything you need to know about Spravato from the perspective of prescribers like you. And I'm going to give you everything you need to feel confident and competent when making evidence-based decisions around treating patients with depression or suicidality. I've got you covered. Okay, so let's get started.
Before we dive in, a big thanks to our sponsor, Marpa Minds, a network of next-generation mental health clinics offering ketamine and Spravato treatments for depression. Go to marpaminds.com for more info.
As clinicians, we all want to serve our patients with utmost care and respect. We never intentionally provide suboptimal care or withhold viable treatments from our patients. And as a prescriber, you constantly incorporate the latest medical knowledge and practices into your standards of care. So today, I'm here to tell you it's time to welcome Spravato therapy into your routine patient care practices. You won't actually need to prescribe Spravato to your patients. You just need to know how to refer patients to the closest Spravato clinic. So it's not hard. I'm going to be honest with you. It's just not acceptable anymore to tell patients that Spravato is beyond your scope of practice and then avoid giving them an informed medical recommendation about it. The field of medicine is always evolving, especially the discipline of psychiatry. Over the last decade, it's evolved rapidly with recent discoveries around AI biomarkers, digital phenotyping, advanced fMRI brain scans, and breakthrough treatments like Spravato and also TMS. So Spravato, it is now an FDA-approved treatment that's also been awarded breakthrough therapy status. It's being used on label. It's not off label like IV or IM ketamine. It is being used right now as a first-line therapy for the conditions it was indicated for: major depressive disorder and treatment-resistant depression. It has its own FDA-approved REMS protocol to ensure standardized safety and efficacy. And finally, it just hit $1.6 billion in annual sales in America too. This is real and big and now. So before we look to the future, let's first reminisce about the so-called Prozac revolution. It started in 1987. It saw SSRIs quickly replace tricyclics and MAOIs as the first line of depression treatment. SSRIs were considered a breakthrough too back then, and rightly so, because they gave prescribers and patients a totally different option for treating depression. So my point here is that innovative psychiatric treatments are nothing new. And as prescribers, you are the expert gatekeepers helping your patients access the right treatments at the right time. And probably when you went through med school or residency or your fellowship, you learned all about SSRIs, SNRIs, tricyclics, MAIs, and atypicals. And then with ECT thrown in as the worst case scenario. And the only mention of ketamine, I guess, was probably as a pain medication or an anesthetic. Yeah? So times have changed and it's a good thing. I guess the first thing to know is that the FDA awarded Spravato the much coveted breakthrough therapy status back in 2013. And they then approved Spravato for patients with treatment-resistant depression in 2019 and subsequently for patients with major depressive disorder plus acute suicidality in 2020, with both of those indications assuming the patient was being prescribed a traditional antidepressant at the same time. And then a game changer again, in January 2025, the FDA also approved Spravato as a monotherapy for patients with treatment-resistant depression again, but this time without them needing to also have a concurrent antidepressant prescription too. So what this means for you as a prescriber is that whilst SSRIs may still technically be the frontline treatment for a short and a minor single depressive episode, for a patient that's got more severe depression that hasn't responded well to 2 or more antidepressants, Spravato is now the first line treatment, and they don't need to be taking antidepressants at the same time anymore. And secondly, for patients that meet the diagnostic criteria for MDD and that are also endorsing active suicidal thoughts, plans or actions, Spravato is now the first line treatment. And remember, we're only talking about depression that's lasted for a minimum of 2 weeks here. So please do not wait to see if the SSRIs work for this kind of patient and then just say, I'll come back in a month or 2 and we'll do some meds monitoring then. Because Spravato is a literal fast-acting lifesaver for people experiencing active suicidality. So make the referral to a Spravato clinic as soon as possible if suicidality is present. And also, if you want to watch some more of our videos at Marpa Minds, particularly about the science behind Spravato's mechanisms of action, or how it compares with antidepressants, or just to know what does actually Spravato feel like, then go ahead and check them out, but after this one. From now on, whenever you are running a differential diagnosis with a depressed patient, please remember that these 2 conditions are all now FDA approved for Spravato as a first-line treatment, and that TRD no longer needs the patient to be taking an antidepressant alongside Spravato. Spravato has quickly become established as a new gold standard for treating patients with TRD and MDD, and as more phase 4 research data is published, the eligibility criteria will undoubtedly expand beyond just these 2 diagnoses. So definitely keep an eye on our channel here, as we're going to add updates as they happen. I'm recording this today in August 2025, and over the last few years the prescribing of Spravato has grown exponentially in America. And as I mentioned already, annualized sales over the last 12 months alone just hit around $1.6 billion, with projected annual sales up to $3.5 billion by 2028. So academia and institutional organized medicine is now on board and accepting Spravato within its ranks. So you do too. Huge numbers of regular people with depression are now asking their primary doctors and their prescribers for referrals to a Spravato clinic. And the timing of this shift is incredibly important. Keep in mind that the CDC recently estimated that the overall prevalence of depression among American adolescents and adults increased by about 60% between 2012 and 2023, while suicide rates have also increased by around 30 to 40% over the last 20 years. And during this time period, the rates of antidepressant prescriptions, as well as benzos and sleeping pills, they've reached all-time highs. So something is clearly wrong here. Our traditional solutions simply not good enough anymore. So the need is huge right now for competent prescribers to know what Spravato is, how it works, which patients are eligible, how to talk about it with your patients, and then refer them to a clinic. I'm now going to summarize briefly how Spravato works and why its mechanism of action is so radically different from and more effective than SSRIs. Alright, so Spravato is the S enantiomer of ketamine, and that just means it's the left side of the ketamine molecule. It's administered as a nasal spray and can only be given to patients in clinics that are officially enrolled in the FDA required REMS program, as I mentioned already. And this ensures that every clinic is using the same standardized evidence-based guidelines and protocols that reduces risk and maximizes patient outcomes. So this clearly isn't a Wild West scenario of unregulated ketamine clinics, is it? You could think of it as a specialist therapeutic procedure that combines regulatory exactness with highly skilled and nurturing practitioners in the clinic whose only patients they ever see are people with depression seeking an alternative to SSRIs. Expert specialists. So Spravato works by targeting glutamate. It's the brain's most abundant excitatory neurotransmitter, which, as you know, plays a key role in learning and memory and mood regulation. And regarding depression treatment, Spravato acts as a non-competitive NMDA receptor antagonist in the prefrontal cortex. And then by partially blocking the NMDA receptors, Spravato helps rebalance glutamate signaling and activates AMPA receptors, which leads to a rapid antidepressant effect, plus also boosts neurogenesis and neuroplasticity in the hippocampus. And as Spravato also has anti-inflammatory properties, it reduces the production of pro-inflammatory cytokines, reduces microglial overactivation, and reduces quinolinic acid levels and increases kynurenic acid levels. This sounds amazing. It really does, but there is a problem. And the problem's not the science, it's the education and the access. So many more patients are eligible for Spravato than actually receive it. Another way I could say it, thousands, potentially millions of real people that would have potentially life-changing benefits from Spravato are not utilizing it, even though they meet the clinical guidelines, have insurance coverage, and there's a Spravato clinic nearby. So where's the bottleneck? Well, sometimes patients might not know about Spravato because it's relatively new, so they keep on cycling from one antidepressant trial to the next. It seems that unless their prescriber has a strong baseline knowledge about Spravato, the referral never gets made. And then it's totally up to the discretion of the patient and luck whether they find their way to a Spravato clinic or not. So this is an education issue. That's why I'm making this video, because too many prescribers still have stigmatized beliefs about ketamine. Perhaps because of the controversy from the 1960s around psychedelics, or perhaps because there is a very genuine and real problem of ketamine being bought and used as a street drug, with some really unfortunate stories of abuse or dependence that is similar to opioids or benzos on the street. But we can't let fear and scaremongering rule over scientific research and data. We have the evidence. We have the established gold standard of clinical best practice. And because Spravato is administered in a clinic within a REMS framework, there is virtually no chance of abuse or dependence developing. Spravato is not street ketamine, and the actual nasal spray device never leaves the clinic, and the patient can only leave once they've received medical clearance to do so. And plus, they're not allowed to drive until the next day. Really safe protocol. So look, I know there's always a time lag between the initial breakthrough happening, getting approval, and then the mass adoption at scale. And whilst some hesitancy in professional due diligence is understandable, it's just no longer excusable or ethically compliant with regards to Spravato. I don't want you to let your patients down because of misinformation or gaps in your clinical practice. We all have a fiduciary duty to our patients and simply can't justify medical skepticism or subjective conservatism superseding our guiding principle of patient-centered care. So, if you're not yet 100% sure about the efficacy of Spravato or how to competently gatekeep this treatment for your patients, then maybe watch this video again and you can speed it up second time round. But also watch some of our other videos here on YouTube about Spravato. Alright, so when you are treatment planning with a patient that's got depression or suicidality, don't just think about the old options of SSRIs, SNRIs, tricyclics, MAOIs and atypicals. These are no longer comprehensive or sufficient for competent medication management. It is now unquestionably essential to include Spravato in your thinking. and we are again in a time of great need. But thankfully, we've now got more options than ever before to treat depression. So looking ahead, there's going to be more and more novel breakthrough treatments coming down the pipeline with psychedelic and psychoplastogen medicines that treat depression, but also PTSD, addiction, TBI, and eating disorders, for example. And consider this. The FDA has also granted breakthrough therapy status to other psychedelic compounds such as MDMA, LSD, and psilocybin. So not just Spravato, although right now Spravato is still the only psychedelic-like medicine that has been legally approved. But we're clearly going through a paradigm shift here. And by you watching this video, it means you're staying up to date as an innovator, being open-minded, and firmly positioning yourself at the forefront of the field. And also, when you go and talk to your patients right now about Spravato, speak to your clinical team and your colleagues at conferences, it literally means that you are also helping to modernize our discipline, and you're also improving patient access to these breakthrough treatments. You're basically saving lives. So please take everything you've heard here and apply it to your clinical practice. Bring it to your team, your patients, and your community. Know where the local Spravato clinic is located. Call them up. Develop familiarity with them. Establish a referral relationship with the team there. And if you are nearby to one of our Spravato clinics at Marpa Minds, we'd love you to reach out and schedule a call or even take a tour of our centre. Okay, thank you for watching this episode of Marpa Minds. We're a network of next generation mental health clinics delivering Spravato and ketamine treatments to patients with depression. To find out more information, go to marpaminds.com. My name is David Drapkin, and I would honestly love you to join the conversation. So please like the video, subscribe to our channel, and let me know your thoughts in the comments below. Cheers.
Thanks again for watching, and thanks to our sponsor, Marpa Minds, a network of next-generation mental health clinics offering Spravato and ketamine treatment for depression. Go to marpaminds.com for more information. This media production is for informational purposes only and is not a substitute for professional, medical, mental health, or legal advice. If you need support, please consult a qualified professional. And we do not encourage or condone illegal activities. Please educate yourself on the laws in your region and consult a medical professional before making any health-related decisions.